How does your federal health insurance, your FEHB, health benefit work in retirement, and Medicare Part B? What a big discussion. When I teach this at federal agencies, you'd be amazed at how passionate folks get about health insurance. And for good reason, because there's a lot of ideas that are floating out there. Your federal health insurance is treated the same way as while working. It seems like it goes up in cost because instead of paying for it every 2 weeks off of your paycheck, you're actually paying for it once a month, which is a little bit more than twice a pay period. Federal health insurance, the acronym FEHB, Federal Employee Health Benefit, and Medicare Part B. How do they work in retirement? There's a lot of rumors, almost urban legends out there. A lot of coworkers, and they'll say, oh, your FEHB goes way up in retirement. Actually, it behaves exactly the same as while working. So how do you explain all that? Well, you pay for your FEHB, your health insurance, every 2 weeks while working. But on into retirement, it's once a month. So it's actually more than twice the per pay period, because there's 26 pay periods total divided by 12 months. So that health insurance, when we say works exactly the same way, we mean it. So open season from November to December, you can elect a new plan as a retiree. Now, at age 65, they're going to tell you you must take Medicare Part B. They would be Social Security. Possibly even some carriers, notable carriers of health insurance federally, will tell you if you have any kind of senior advantage plan, they may say you've got to take Medicare Part B and your plan here will become secondary. You do not have to. Most federal employees use their FEHB, their federal health insurance, as a Medicare Part B replacement, meaning they don't elect Medicare Part B. If you elected both, you will have to pay for both. You want to keep that in mind. So most federal employees keep their federal health insurance, it's an 80-20 plan, as Medicare Part B is an 80-20 plan. Now, for those of you who are TriCare recipients, you're automatically going to be put into Medicare Part B at age 65, and you'll become TriCare for life. And you don't need FEHB at all. And some of you have carried both while working. I would suggest to re-examine that as well.